we're holding this session through Zoom, and we'll post the session on the board's YouTube channel. There's sign language interpreters on the session and also a real-time captioner. We're doing this to allow for public engagement, allow the public to participate, and allow the public to provide feedback on licensing regulation of sign language interpreters. Today's session is not a public meeting. If there are board members and Rules Advisory Committee members in attendance, they're here to observe. There won't be any discussion, deliberation, or decisions made. Health Licensing Office is here to gather information and take notes, and then we will report that information back to the board. Questions will not be answered during the session, but if you have questions, you can email josh.page@oha.oregon.gov. Some important dates to have in the back of your mind would be September 26th is the date that Senate Bill 950, becomes effective. So that's when we can start the official rulemaking process. The board is scheduled to approve proposed rules on October 22nd. Public comment is expected to be November 1st to November 28th. There'll be a public hearing on November 19th, and the board is expected to adopt permanent rules on December 11th. How to participate. We request that you use the Zoom hand raise feature, and when your name is called, state your first and last name. Each person will be given 3 minutes to comment. If there is extra time at the end, then additional comments can be made by the same person. Otherwise, we'll take them in as each person raises their hand. We're going to try to keep track of that. Make sure to speak clearly for the interpreter and captioner. Keep your phones muted and remain off camera when you're not providing comments. The chat feature has been disabled, and we request that you use appropriate language, manners, and protocols. We will now open the session for comments. So you can start by raising your Zoom hand. And I'm going to go off screen and see who's raising their hand. Well, nobody so far, but we are going to be here on logged in and waiting for hands to raise until 7. So we'll be monitoring, and as soon as we see a hand raised, then you'll be able to make your comments.
It looks like we have a hand up, Sarah.
Yeah. Sarah.
Yes, hi. I don't know if you can hear me.
Yes, we can.
I apologize. It took us a little bit to get into the meeting. So I'm just wanting clarification. You're just asking for general questions about licensure. I was my understanding there would be like a introduction to where we're at so far. So I'm wondering if it might be helpful for everyone to just recap. You just kind of briefly mentioned the waiver extension. Um, but I think I don't know, maybe everyone else is all up to date on what has been recently decided. Unfortunately, I have missed out on being able to view the last couple sessions, so I don't know if it's possible for someone to just do a brief recap, and then that might help us figure out which we have a lot of, I know there's a lot of questions out there, but I think until we know kind of the more recent update on I know I've heard lots of questions about costs and it sounds like the extension, but if you have already started the process of licensure, you will have to pay late fees. And um, some of us went ahead and renewed licensures because we weren't sure. For example, mine expired at the end of August, and was I gonna be in compliance if I didn't go ahead and just renew the medical, even though I know that's going away. So I think those are some of the questions that I've been hearing, but I wonder if it would be helpful just for everybody in the room's sake to just kind of get that more recent update.
Yeah, this is Sammy. We're actually just gathering information. So you guys give us information and then we're going to take all the information and report it back out, use it to draft rule changes, things like that. The waiver is in place till June 30th, 2026.
So to that question, then I've been hearing some concern about to be in compliance. Again, many of us have just gone ahead with renewing and some haven't, which is, I understand. The question was if there'll be late fees if you do not renew and you go ahead and accept the waiver, but you've already been licensed. Has that already been discussed? I know that's a concern or a frustration, I will
Yeah,
say.
we're actually not answering questions today,
Oh, okay. All right.
but we're happy to take down the questions and then we plan on putting out an FAQ on some of this information.
Okay, got you. Thank you for clarifying, and I apologize. I'm a
Oh, no
little
problem.
off track because feel like I missed any much of an introduction, so I appreciate you helping me clarify what this session is about.
No problem.
Hi, this is Emily Herb. My pronouns are she, her. And I think it would be helpful if we knew what sort of information that you're seeking to gather. Um, I feel myself like I'm kind of confused by this process. We have a really great turnout of interpreters here on the Zoom. And so I know that you're not answering any questions, but if you could provide us perhaps some sort of context about what sort of information that you are hoping to gather by holding this session.
Sure. So what we're looking for is to collect feedback, experience, and suggestions from those impacted um, or who are involved in sign language interpreting services, and all members, deaf community members, interpreters, interpreter professionals, organizations, how Senate Bill 950 and the changes, how those changes in the bill would impact licensing and regulation. And so kind of moving forward in the next 3 months when we're having to draft rules for the new Senate bill, we're looking for feedback on how you see those things, what your interpretation of those law changes are, just an opportunity for you to provide feedback about anything, about what you think the licensing should be, or what the fees you think they should be, or states that you think have a better process. It could be really anything. Hi, Ashley.
Hi, can you hear me?
Yes.
My name is Ashley Sasanti. I am a K through 12 interpreter for Portland Public Schools. And before I complain a little bit, I want to be clear that I support licensure for interpreters, and I always have. Um, I think it's very important for there to be a system of accountability and to make sure that deaf people have the best services that they possibly can. Like I said, I'm a K through 12 interpreter, and I got my supervisory license a year ago. I don't know. I don't know the timeline, but I have just recently renewed my supervisory license, even though I primarily work in K through 12 settings, which is what we want. We want supervisory level interpreters in K through 12. But the rest of most of my colleagues had an educational license, but did not need to renew. But I did. So now currently I'm out $550, which ordinarily I would be happy to pay if I thought that it was benefiting deaf people. But I'm not sure that it is. And so I'm a little bit salty about the $550. Especially because I feel like I was following all the rules and I wanted to do this cool thing where deaf people would have a say. But I don't feel like that's happening, and it's a lot of money to feel like for what? Um, but that's it. Thank you.
Thanks, Ashley. Aubrey?
Hi, I had a question. Oh, I'll let the interpreter switch. Um, I had a question about the training license specifically. Um, a lot of the requirements are incredibly vague, and as an ITP student, that's a little bit concerning, especially for upcoming grads or people who have already graduated. The required credentials just say to be determined by the board. There's not anything specific, and the cost of this potential license is also not explicitly listed like the other licenses. So that's just my comment.
Aubrey? Do you have any ideas of what it should be?
I don't have any specific ideas. I was just reviewing the bill and looking on the ORID website, and it's just a little bit ambiguous, but I'm kind of unsure the difference between a training license and a provisional license. Both seem to be uh training wheels for new interpreters, but the difference between them is kind of muddled. And I'm not sure if the training license would be for example, some interpreting programs have required hours for experience that they need to gather every term. Would that be for students who will graduate, people who have already graduated? I'm just unsure the specific demographic for each license. And I know every interpreter's journey is different and unique, but I think it should be more clear and uh, laid out.
Thanks, Aubrey. That's helpful. I don't want to butcher that name.
Demeter.
Yes.
Yeah.
And then Andrea.
Oh, but me first, correct?
Yeah.
Okay. Okay. Um, my name's Demeter, and I was an ITP student about 6 years ago, but I am currently a behavior professional that works both in Salem and the greater rural area all across Oregon with deaf IDD clients. So we have a
You're
lot of,
freezing.
okay, am I unfrozen?
Terminator, you're freezing.
I hear her fine.
You're frozen. Officially.
Okay, but can you hear me okay? Because I'll turn off the video.
I can hear
Or
you.
am I frozen?
Okay.
I might be.
Okay. Okay, I'll keep going. Can you hear me
Yeah,
okay?
we
Okay.
can hear you. Yeah.
Yes.
Okay. Yes, I'm a behavior professional and I work with primarily deaf IDD clients, which very much require regular meetings with case management. They have regular check-ins with their providers that don't always have language access themselves. We have a severe shortage. I'm aware of CDIs in the state, and a lot of times my clients are waiting for months to get access to things that typically my hearing clients can get without a problem because we're waiting on interpreters. And because I do work with a lot of interpreters myself, I have gotten feedback that in the last 5 years, the process of licensure and certification has just become so muddled that people are afraid. I've had interpreters that have actively been interpreting for a couple years, but not licensed yet, coming and telling me that they're concerned that they're going to be arrested if they interpret without a license or do the things that they had already been doing before this bill came along. So from my experience and the feedback that I've gotten, that also has caused a lot of interpreters that were doing very good services to back out and leave because they were afraid of whatever repercussions might be coming their way. So, as a behavior professional of people that work with a very vulnerable population of deaf clients, just understanding that it is also impacting them very heavily because they are not able to go and have these meetings that have every right to get access to. So I can't speak on what would be a good thing to make it less confusing, but I do know that the process itself has caused a lot of fear in the local community, and we are waiting for longer times just because the lack of availability for certified interpreters, both CDIs and hearing interpreters.
Go ahead, Andrea. Thank you, Derminer.
Thank you. I have two separate comments related to licensure. The first is on the fee schedule, and I would like to recommend that that be a every 3-year renewal cycle instead of every year. That will hopefully relieve some of the stress on HLO as they're having people renew. And it also relieves some of the burden on us as interpreters to hopefully keep us out in the field. As Demeter was just mentioning, there is a shortage of interpreters. So to be able to have the fee structure be every 3 years instead of every year would be a perk on both sides. The second piece would be the auto update system that HLO has in sending out emails to those who need to renew their license. I know many of us got that email this year of your license is going to be expiring for those who have educational, medical, the specialty licenses. And it didn't reflect the law SB 950 that had already passed. And so a lot of people were in a panic and confused. So if there's some way to update the system and inform the HLO staff who are going to be interacting with sign language interpreter licensure stuff, questions, that would be very, very helpful as well to make sure it's up to date and everybody's getting the same information.
Can the interpreters lower the camera? Some people are having trouble seeing the signs. Thank you.
Go ahead, Sarah.
Thank you. I am just wanting to add in, just because I'm wanting to let other people have an opportunity to share as well, but just as an agency owner, the impacts are like potentially very ongoing with having this elongated, very confusing process from I've lost interpreters who have just decided to retire or leave the state because of the whole process, or just plain not renew. And I'm literally personally paying out of pocket to try to hold on to some of those that are just fed up with well, I renewed and I didn't have to, and now if I don't, I get charged a fine. And so it's unfortunate. And I think one of the major concerns that I've seen, we've lost a bunch of supervisory interpreters in this process. And some of their questions have been, there's no benefit and a higher cost for being a supervisory interpreter. Why would I do that? There's more, there's no benefit for us. So that was something I did want to make sure was added for their sakes. The other ripple effect has come through in contracts. So some of the other, particularly medical entities, have started writing in their contracts some of the language, and I tried to like come back and say, this hasn't been decided, this hasn't been decided, but we're, at some point we had to sign contract in the middle of this whole messy process. I tried to say, let's stick with following the state laws, but what we've come down with is now we have contracts that are even more stringent and have higher requirements than our current amended laws. So, yeah, I get that this has been a long and painful process, and there's just no way to know all the details, but some of the communication on the website was also just super misleading and unhelpful because we've had interpreters who had enough qualification end up thinking they had to go and get fully RAD certification if they had NAD. And so it's been really, and we all know it's been messy, but if there's anything that I hope that we can do better, the website itself, I had contractors going and looking at the website and not being able to find any information. And I had to like pull information off of applications to find out what are the actual requirements for medical interpreters to work. And and actually that's gone away now. So all that is to say, it means that I have fewer interpreters available for medical interpreting because of that whole messiness. And so even fewer patients are getting served right now because of that. Thank you. That was Sarah Haig again.
Hi, Anne, go ahead.
Hey, hey, I have a question about the website and the fees listed on the website. Uh, I have a supervisory. I paid $350. The website says it costs 200, I believe. And then I'm looking at October's, or I'm sorry, it says 150. Is that right? 150. And then the renewal for the supervisory is 200. So confusing. I'm coming up to have to renew in October, but now listening to everybody else, now I'm not sure if I do because I'm unfamiliar with 950. So wondering if maybe the website could just have updated information to clarify these questions. That's it. Thank you. I'm out of state, if that makes any difference. Thanks.
Google Pixel.
Hi, my name's Lana. I'm an interpreter, but I work just a couple appointments a week. So therefore, the fees were of concern to me because I don't work enough to, you know, have a lot of extra costs. So I'd like to just kind of put that out there.
Thanks, Lana. Hi, Alyssa, go ahead.
Yeah, hi there. My name is Elisa Hoover, and I am a staff university interpreter and freelance interpreter. I wanted to just pass on to you all that there has been a lot of confusion and uncertainty in the interpreting community because of the communication or lack thereof about the licensure process. Many people, as we've even seen here, don't even know what's going on, and that's led to a lot of just not knowing what to do or where to find that information. So if there is some way to improve that, it would be greatly appreciated. As things stand now, licensure has changed so many times and requirements keep going back and forth that it doesn't even seem to mean anything. And we don't know where to find clarification for those things. As others have already mentioned, there's a marked interpreter shortage. And with pricing as it stands now, interpreters like Lana just mentioned, there are some who only work a few hours here and there. And those who are important to our profession may even be priced out, which will worsen the situation. I know in the RAC meetings, there has been discussion of CEU requirements and even for those holding supervisory licenses being required to log supervision hours. And I just wanted to throw out there that for interpreters who are in more rural areas or more limited segments of the profession who may not have access to provisional license holders to work with, it may be hard to satisfy those requirements. And also, it could be detrimental to upcoming interpreters if we have interpreters who are supervising them only to fulfill a requirement instead of really genuinely wanting to invest in those upcoming interpreters. Thank you.
Hi, Jacqueline.
Right, I have to turn the mic off. Sorry, guys. Okay, so I have two things that I would like to bring up. Um, the second is about costs, which seems a bit redundant, but it's at two different points that I would like to emphasize. But firstly, I want to vent a concern about what OHA is requiring versus what ODE is telling us educational interpreters. I don't know if maybe just the specific school district I work for was misinformed or misunderstood, but they are telling the interpreters in this district that we are required to have licensure at this time. And that's frustrating as a certified for over 3 years interpreter who decided to go and get the supervisory instead of the educational license because they don't pay well and I have to fork out way more money than someone who just gets the educational license. And both are obviously used to work in education, but it's a bit of a frustrating thing. And the district also refuses to pay for licensure fees, but they will pay for certification fees. So interesting. So that, I guess I would wish that all of the state agencies were on the same page about what's being required, because right now it seems like there is a big misunderstanding. Um, secondly, about the costs, for licensure. Again, going back to I've worked for nearly 10 years in education now. I've been certified for over 3 years. Went ahead and got the supervisory license because I do care about the upcoming generation of interpreters, and I would like to be a mentor to them. I didn't realize that the new updates will require it. I'm actually thrilled about that. Um, but hearing that the medical licensure will be gone, I'm wondering, is that going to impact like OHA's medical healthcare interpreter list? Are all of those requirements still going to be implemented? Because the trainings for such are also very expensive. Medical interpreters get paid more than educational, I get that. Um, but having just taken the training and I was expecting to have to do all of this other stuff, I would like more clarification about that as well. Thank you.
Hi, Emily, go ahead.
Sorry about mute. My name is Emily Critchley, and I just wanted to kind of drop in my 2 cents worth as an interpreter who has actually been on hiatus for the last 3 years, raising a child. I worked out of state in California, and so I actually finished working in the middle of the pandemic before I had my daughter. So as someone who has been out of the profession for a while, who is considering maybe coming back, I'll admit I haven't done my due diligence about what's going on as probably as much as I could have. But it also sounds like there is a lot of confusion. And so I think it's just important to note that as someone who is considering coming back to a profession where clearly there is a lot of need, um, this process is in some ways making my decision easier and making my decision harder, even though I haven't made it yet. So that's just kind of the perspective that I wanted to lend as a different perspective out there from someone who's not been actively interpreting for a while. Initially, I was really happy to see that Oregon would be pursuing licensure. Having come from working mostly K through 12 for 15 years in California, there's not a lot of standardization down there. And so I was hoping that that would be the eventual case here with the pay grade to match. But it sounds like we're still a ways off from that. And I do feel that the pay should be sufficient if we are going to be required to be licensed by the state, as well as ensuring that there is a standardization of quality interpreting out there. So that's just my 2 cents worth. Thank you very much.
Hi, Melanie. Go ahead.
Hi, my name is Melanie Poole, and I would like some clarification and comments about seat hours. It's not really clear at this moment from some of ODE's website postings whether or not seat hours are required for K-12 interpreters. They seem to have removed standard, I believe it's Roman numeral number 4 that says 12 seat hours are required to work in K-12. And so it'd be great to have some clarity, like the national certification, they already have an entity that tracks all of our seat hours. And so purchasing a license with a national certification has that tracking system. But if you're getting a license and you have an EIPA score and you are not RID certified, then is there going to be an entity that tracks the seat hours for the yearly requirement for those, or are those going away? I believe that the RAC team values the improvement of K-12 interpreting or just interpreting in general. And so it would be great to have clarity around where the tracking for the EIPA scores when you're using those for your license there is coming from. And then also some clarity on if you purchased a license that's a supervisory license or a general license and you're going to change it. Maybe I'm going from a supervisory to a general or a general to a supervisory. Do I need to pay for the processing fee and then the cost of that license? So initially I purchased a supervisory license and so I paid the processing fee for the first time doing that. And then I paid the supervisory fee. And then this year, when it said I needed to renew, I paid just the $200 for the supervisory license. And I believe I'm going to switch to a different license when all of the changes are established. And so it'd be nice to have clarity on, do you have to pay another processing fee because you're changing up the license that you initially have taken? Because even those who go from one license to another, they will need to know that if, as well. So clarity around those points would be great. And then I agree, if ODE can send out or be on the same page since they're involved in all the RAC meetings, that the RAC group has decided and send that up to us. It has been rather frustrating to learn you need your license, and 2 weeks later, after school started and we all rushed and got our licenses, no, you don't need it anymore. And then, like others have voiced, we're hearing January 26th, you don't, is when fees will be reestablished. Okay, but I'm getting emails that say I have to renew my license or then I'm going to get fees. And then interpreters are saying, well, it's still a law, right? The 950 is still in effect. And so that law, that 950 says you have to have a license in order to interpret in the state. Okay, but then what about June of 2026? If that, so we need some clarity around when we actually need to have our licenses and how all these processes follow suit and how seat hours are going to be tracked to ensure that we are following the correct procedures. Thank you for your time.
Hi, Ashley, go ahead.
Hi. I just want to clarify for the interpretation that it's seat hours, SEAT, SEAT, seat hours. Yeah, it's like CEUs, but for educational interpreters, just for future people who are watching this, seat hours.
Are you okay if I go?
Yes, sorry about that. I
That's
was off
okay.
screen.
That's okay. Um, this is Demeter again. I just want to reemphasize, we hear a lot of misunderstanding in the field with the actual interpreters about their own licensure and certification. And part of my job as a behavior professional, especially for deaf clients, is to educate the greater community on no, you can't just pick up this client's friend and take them to this doctor's appointment. They need to have their, certifications and make sure they are licensed. And my job is trying to educate the general public about how to use interpreters as well. And I will tell you that it has been confusing for the companies that do want to do the right thing. They don't understand that there is a difference between an educational license and a medical license, and or that there's a difference between certification or licensure. Like the all the jargon in the interpreting field is been it's being thrown out, and again people are reacting very quickly. They want to do the right thing. I feel like the greater community wants to meet the need and that accessibility, but they are very confused because they don't even understand, and when the interpreters don't understand what they need for themselves, how are you going to expect the greater community to know what they need? So there has been some issues from my standpoint of trying to educate and let them know the difference between, no, you can't just get Joe Schmo on the street. You do have to get someone that's had education and CEUs and whatnot. So I just wanted to reemphasize that while it's confusing for both the interpreters and the greater community who wants to use an interpreter.
Yvette, am I saying that right?
Yes. My name is Hilda Colondres. Uh, Yvette's my friend who use this. I'm using her Zoom anyway. I am a sign language interpreter of 29 years. I want to echo what everyone has said here. I also want to add one more little conundrum. I live in Vancouver, Washington, and I am occasionally hired to go into Portland or Oregon as a whole for medical healthcare interpreting. I don't know if I should get a license, provisional, all the other terms that other people are saying. Do I get it? I only go there once a month, this year. Maybe next year I'll go a few more times than that. The language is confusing. It doesn't actually have a section for interpreters that are coming in from Washington. And it is cost prohibited. If I only go in once a month, at the end of the year, it doesn't balance out. My books don't balance out. So I just wanted to put that out there also.
Go ahead, Kayla. Sorry, that's my dog whining.
Hi, my name is Kayla Graham. I am an educational K-12 interpreter, and I just wanted some clarification on how long the licenses will actually be good for. I have seen some conflicting information about licenses that may have been issued last year in 2024 that the specialty licenses specifically may now be good for 3 years with the passing of SB 950. I've also seen information that the non-specialty licenses may also qualify under that, but it has been unclear. And if there is a cutoff date for that 3-year period. So if licenses issued before or after a certain date qualify to be good until 2029, or if there's a more specific time frame for that. Thanks.
Hi, Kate, go ahead, and then Melanie.
Hi, my name is Kay Butler. I'm a K-12 interpreter. I got the educational license along with all the rest of my colleagues. And when we were going to go back to school this year, I think everyone except for the people who got supervisory licenses got 2 renewal notices in the mail, one for $100 and one for $150. And through the grapevine, I learned that it was a mistake and I wasn't supposed to get 2. And anyway, I didn't renew it anyway because it's not gonna be a thing anymore soon. But I didn't get any formal notice like that about the mistake or why that happened or which one was supposed to be right. So I think there should be clarification around that. I also think that the licensure cost is too high. I think that it's going to be a barrier for a lot of people who would serve the deaf community very well. And I'm not sure if this is correct, but I've heard, I think, that the licensure, how much it costs to have a license, is based on how many people are going to get that license. So is that still the case, or is it kind of arbitrary? I think that there should be more clarity around why the licensure is like why does it cost the amount it costs? And I also think that a lot of this information is written in some technical jargon, and a lot of it is in English on websites that are very text dense. I think all of this information should be available in ASL. That's all.
Hi, this is Melanie. I also wanted to mention that when decisions about renewal for educational licenses, or there won't be educational license, I believe it'll be called provisionary, and forgive me if I have the wrong title for that, but when you're contemplating how many terms that can be renewed, please take into heavy consideration the length of time it is taking for testing results to be given. So if I'm a K-12 interpreter and I don't have a 4.0 to get a general license, I have a 3.5, so I can still work under the current standards. But I only can renew so many times. I would hate to lose interpreters because they ran out of renewals because it takes a year for EIPA test results to get back to the interpreter. And then they need time to practice, to improve their skills in those particular areas, to take the test again and to see if they passed another year. I know, and the NIC is always an option of a test that an interpreter can take. But if I'm only focused on K-12, I have no interest in freelance. And all the feedback that the EIPA gives is phenomenal. Unfortunately, they just have a really long timeline. So I would like for the consideration of when you're considering how many renewals the license can have before they must get a general license, to consider how long it's taking for test results to get back. Thank you.
I guess I'll go. My name's Andrea again. And I would love to echo again what Melanie just said about EIPA test results taking a year or more to get back from the date you test to a year later, you're still waiting for your results. So that definitely needs to be considered in the renewal process. So yes, 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 100% support having that be a consideration in the educational, provisional, general, whatever licenses renewal process. That needs to be a factor that we consider in that renewal structure and how many times. I would also like to share, for those who maybe are out of state, or a great resource for all of us, go onto the ORID webpage, orid.org/Oregon-licensure. And that's a great place for a breakdown of frequently asked questions, the different licensure options, ways to contact ORID. It also has links back to HLO for where that source material is coming from, and Senate Bill 950. So that's a great hub of a resource for those who are lost and need to get caught up on all the things that have happened so far. And then thirdly, really quick, for supervisory license, I believe that we need to set up a system of approval for those who are writing down this name of, this is going to be my supervisor interpreter, without that supervisory interpreter knowing. There needs to be a checks and balances to make sure that, yes, that supervisory interpreter is willing to take on that trainee license or provisional license interpreter to supervise, and is aware of their work. So some system to track that would be really, really critical.
Hey, it's so my name is Ann Cook. I didn't say that the first time. In the beginning, you, Sammy, sorry, I think that's your name, asked a question about what are other states that are doing licensing well. I work for a company and so I have to hold all a whole bunch of licenses, about 8 nationally. I'm also in charge of disseminating the licensing information to my team of about 32 other interpreters. And so I spent a lot of time looking at these things. So 2 states to look at are Idaho and Wisconsin. Idaho just updated their information, their their process, and it's very good. It's all online. It's very clear. It's very easy to do. Because the one thing that's a pain, besides the cost, which I'm going to get to, is that when we have to renew on an annual or biannual basis, and you're doing it times 8 or times a certain number of licenses that you hold, it's a pain. It's a lot of work. And mailing with stamps is gets pretty old and gets to be a lot of work. So doing it online, paying with a credit card and all of that, using a Credly to download your little badge to show proof that you're certified, for example. So these are all things that other states do, and it makes the whole process a lot more seamless and a lot less cumbersome for the interpreters. And then the second is getting to the cost. So this Oregon's cost of license is more than any state I've ever seen. And because of that, our company said we're only gonna and so I'm sorry, everybody, but for those of you who I know you don't get reimbursed, I do get reimbursed for the cost. And I know I'm very lucky with that, but they will only reimburse the very few people who are specifically touching Oregon in our interpreting. So because they even at that level, they were like that, we're not reimbursing $350. That's ridiculous. So so that's a note on cost. The last thing I have to say, or question that I have that I know you won't answer, but is a question, is if you work VRI in Oregon and you're a company full of people, of interpreters, will you be offering a business license? A business license that will enable me to apply for that business license and cover all 32 of the interpreters that work for our employees in Oregon. And I don't think I know that I haven't seen this yet in Oregon. I hadn't looked into it because I know you're all still new and getting things set up, but I just thought I'd throw that out there. Okay, thank you.
Thanks, Anne. That was really helpful.
You are welcome. Thank you.
Aubrey and then Sarah.
Hi, this is Aubrey speaking. My questions are a little bit random, all over the place. They have a few jumping off points, so I'll just go in order. I noticed, and other people have mentioned, that the provisional license has limited renewals. And I was wondering if the same would be applied to something like a training license. Currently, it doesn't mention anything about a renewal limit. Would there be a renewal limit? And what is the rationale for the number of renewals? How did the number 2 come up? And originally, if I remember correctly, the licenses were supposed to be renewed annually, but now it's every 3 years. At least that's what the ORID website clarifies. And I'm just curious where these numbers are coming from. I just wish there was a little bit more transparency of where these numbers are coming from. And for the licenses specifically, it seems to go up in a hierarchical process. And I don't know if that's just my perception, but it seems to start with training, provisional, general, supervisory, and an interpreter is supposed to come up in the ranks, if you will, with the licenses. this doesn't apply to me currently, but would an interpreter have to hold two licenses, a general license as well as a supervisory license, or does one cover the other? Um, and I took one of the suggestions of the other interpreters to look at Idaho's regulations and what their policies look like. And their costs are as low as $25. And some, it ranges for the license, but it's from $25 to $75, where our costs are looking like 200 and 150. So kind of what others are mentioning, where are these numbers coming from and what is the rationale for this? And most importantly, when it comes to licensing, are ITP students exempt or included? And what would these costs look like for very new interpreters coming into the field? And those are all of my questions.
Hi, this is Sarah again. I did want to make space if anybody else wanted to jump in. But just wanted to cover a couple things that I haven't heard yet. Regarding the supervisory license, I've heard quite a bit of concern. I think this has been changed, or it sounds like it may be changed, that it's not going to be a requirement that everybody gets a supervisory license. I think I support absolutely investing in the next generation of interpreters myself, but I also agree with a lot of concerns about and just anyone being able to be prepared to be a supervisory interpreter. And then the other thing that has been mentioned was just clarification on what does that process look like? And I know that's a whole nother animal of how do we record supervisory hours and prove all of that. So that's a whole nother area. But I think in general, some of the things that were highlighted, as well as the conflicts between ODE requirements and the OHA licensure for educational interpreters, and then the conflicts between the HCI registry and the OHA licensure, which most medical places are asking for the registry number, but I'm concerned that the medical licensure has gone away. I felt that it was a little at odds and not in line with the registry requirements, but I'm also concerned in light of the Medicaid scheduling portal, and some of the things that I've heard from the team that's working on information gathering there, around how they're going to vet interpreters. And I understand they'll still be required to have at least a general license. So that's some balance there, but yeah, I'm just wondering how that's all going to look, because we do have some interpreters currently that are medically qualified, but would not be a good choice to interpret for anyone. Yes, the only other thing I was just going to mention too is I'm wondering if it's possible to have another question answering session similar to this. It sounds like we've brought up a lot of questions. I'm hoping that there will be an opportunity to have those questions answered. I appreciate that you're gathering information to bring back to the board, but I would hope that there'd be an opportunity to have a lot of these questions asked and then answered as well. Thank you.
Hi, Shauna, go ahead.
Sorry, couldn't not get my unmute done. So my name is Shauna Klein and I work for a hospital in Eastern Oregon. And I'm not sure I'm not totally familiar with the new bill and all of that, but there were some concerns because our organization uses video remote interpreting that includes sign language. And so the question has come up that I was asked to bring here, if with the changes, if we are going to be able to use sign language interpreters that are not necessarily licensed in the state of Oregon. And I know there's a lot of things going on with the Oregon interpreters in general, but just concerns because a lot of healthcare systems utilize that option instead of having on-site interpreters or not being able to have access to specifically sign language interpreters locally, and what kind of impact that's going to have on the organizations with these changes.
Hi, Colleen.
Oops, I lost the interpreter's picture. Just a second. Okay. I want to go back to a previous comment from the person from Eastern Oregon. That's perfect. I do feel that it's not clear the legal requirement for VRI interpreters to have licensure, or only on-site interpreters. And what about interpreters crossing from Washington into Oregon? So would that apply to them equally? Visiting Oregon, for example, for a conference or temporarily, is there maybe a temporary license option? But I think that wouldn't be possible because of restrictions on the bill. That's just something that I think hasn't been brought up yet. But I wanted to. Thank you.
Hi, Shauna. Go ahead.
So sorry, I'm on my phone and technical difficulties. So another question that was brought up by the previous comment, and I think someone had mentioned earlier that there's not going to be a license for medical interpreting, which is something that is required through Medicare, that we utilize medical certified interpreters. And so something to consider that might create some limitations for healthcare organizations to use local people if there's no way to classify them as being competent to do medical interpretation.
L. Connor.
Hello. Okay, this is Luann Connor. I have been a sign language interpreter for a very long time. I run a group of interpreters. I've read all the information. I kind of keep up with all the talking on Facebook. I read all the ORID information. I have all the licenses. They all expired in July. I paid uh, 550 or $700 when I got them last year. I did not renew yet because I was going to wait and see how it all shakes down. I have no idea. I have 100 and some interpreters. I don't know what it is that I'm supposed to do. I got all the renewals. I tried to renew online. I can't. I don't know why. I'm not sure. Is it going to cost me $200 and I only renew the supervisory? I don't even know. Is there anybody that can give me 2 minutes, the cliff notes of what it is I'm supposed to do? And is it going to cost me another $200? Because I heard that somehow if I paid $700 last year, I got grandfathered in till 29 or something, but I still got renewals for all of legal, medical, and supervisory in the mail. They would like me to pay for all those again, which I would not like to. So I don't know what it is that I'm supposed to do. There you go. If I don't know what I'm supposed to do, it's hard for me to tell everyone else what they're supposed to do. So I read all the ORID information, not sure where I stand or what I'm supposed to do. Thank you so much.
Hi, Andrea, go ahead.
I'll point that last commenter to, again, the ORID webpage. Frequently asked question number 5. It says, any specialty licenses obtained before January 1st, 2026, which is the educational, the medical, or the legal, will remain valid until January 1st, 2029. And then it has a link to that specific law that you can print and have. That does not, however, apply to the supervisory provisional generalist. So it's just the specialty licenses, according to the frequently asked questions and the law there, that are good through 2029.
Okay, this is Luann again. So that means the specialty ones I don't need to renew, but the supervisory has to be renewed now for $200. That one is not grandfathered.
I was just curious if anyone showed up for the meeting. I thought maybe I could join last minute for some.
Just wanted to see if there was anyone that could summarize what's been going on since I joined last minute.
I didn't hear what you said.
To do that. Yeah, I'd like to know what's happening in the meeting. Can somebody catch me up?
This is Sammy. It's people are just providing feedback on questions that they have and concerns that they have about licensing. And we're taking down those notes.
Okay, thank you.
Hi, Jen, go ahead.
Hi, this is Jen. Can you guys hear me okay?
Yes.
Okay. At the very beginning, I think you mentioned, well, I want to make sure. You said that we are gathering information and questions and comments and whatnot. And did you say that this will be put into an FAQ and posted somewhere? And if so, where would we find that information?
Some of there, it's possible some of this will be in an FAQ, and it would be on the website, and we would send it out to the same people that we sent this notice out to for this type of meeting.
Thank you.
Hi, Becky, go ahead.
I had to figure out how to get my voice back on. Hold on just a moment.
Hi, Becky, go ahead.
Hi, can you hear me okay? Yes, I think so. Okay. Hello, my name is Becky Orley. I'm from Southern Oregon. I've been interpreting for 33 years and professionally, 19 additional unprofessionally, as I am a CODA. My parents are both deaf. I have deaf siblings, nieces and nephews, and so forth. So licensure is near and dear to my heart. Um, I work in education, but I've also done freelance for many years. When licensure was coming up, I stopped doing freelance. I figured I would resume once everything has been settled. As we all know, it just keeps dragging on. I want to echo all the concerns of others. There is no clarity. There's much more confusion. I've watched many board meetings and RAC meetings, which I believe have led me to become more confused than ever. Excuse me, than ever. I know that you stated at the beginning of this meeting, it's to gather information. I think I I myself thought that there would be some type of moderator or somebody asking questions in order to gather information rather than just an open mic. One of my major concerns is we don't seem to have um, deaf people from the deaf community participating in this. Most everybody that I've heard from tonight have been interpreters, if not all, have been interpreters. Um, this licensure has major impact on the deaf community, and we need to hear from them. So I hope that another meeting will be available and we have more participants because this is affecting a lot of people. That's all I have to say. Thank you.
I have my hand raised. Am I supposed to wait for somebody to call on me?
No, go ahead, Jill, and then Colleen.
Okay. I want to second what she said about having deaf people in the meeting. I think that the licensure has been presented to the deaf community as the answer for getting qualified interpreters at all of their assignments. And I think that there is some of that, right? I mean, definitely we want to have qualified interpreters for the deaf community. I have a deaf husband myself, and I want him to get qualified interpreters. However, I don't think they have been presented with the information of what a shortage this might cause them and what a hardship this could be on some interpreters who particularly only work part-time. I remember when I was raising my kids, I've been interpreting for 30 years, but when I was raising my kids, I worked 12 to 15 hours a month is all. And I couldn't have afforded to keep my RID, to take my CEUs, to get my licensures in both Oregon and then eventually someday in Washington. It just would have been too much for me, and I would have bowed out of interpreting. And I'm grateful that that wasn't my situation, and now I'm back working full time and enjoying my jobs within the deaf community. But I would not have been able to maintain all of those fees and things with working part-time, and lives are variable, right? I mean, sometimes interpreters have the opportunity to work full-time and sometimes they don't. But if the CEUs remain the same and the RID things remain the same, and then we have to get licensure, I think that the deaf community has not been presented with the fact that it might have a negative impact on interpreter shortage. I want us to have qualified interpreters. I really think that's super important, but I'm not sure that this is the complete answer. Thanks. That's all.
Okay, can you see me? Are we good? I wanted to make that comment about the frequently asked questions and being able to have some communication where we can go back and forth. The FAQ, I think, will help, and that will go to the deaf community, and we need to get that education.
I'm having a
out
hard
there
time
and let
hearing you,
them
interpreter.
review.
I'm having a hard time hearing you.
Should I go back? There is some information, and I know Darcy had commented, we do need to go back and review that information and the FAQs and collect that and get that on the website. That would be nice. And have the information in ASL. And we kind of do understand that there is an impact, and we do want to empower deaf people at the same time and inform them about what's happening. And I think the FAQs might help the community.
Thank you. Over to Darcy.
Go ahead, Darcy.
Can you see me? We good? All right. Well, I agree with Colleen and those points, and Jill, about the points about the deaf community in general. Many understand certification and licensure, and some don't. And I think that we do need to host maybe something, a gathering, and include the deaf community to do a clear explanation about what it means to be certified versus licensed, and really focus on explaining the licenses and comparing it to certification, and really give them some in-depth knowledge that's clear, because it has been confusing. And they have concerns about, do they have to be medically licensed? And oh no, now they're throwing that out the window. I think HOL licensure was set up within the state, and there's some information that's missing, and I think we need to clarify, and having that in ASL on the website might help with that, and talk about the medical licensure and the other licenses, and help them to understand clearly what's been happening. So that might need to happen in the future. I'm just putting it out there. Okay, thank you.
Go ahead, Jen.
Hi, thank you. I just want to say thank you for everybody sharing what you did tonight. I second like everything that everybody has been saying. So I really appreciate everybody and just being vulnerable and kind of talking about what's been going on. So thank you, everyone. Thank you for hosting this. And I also want to just throw it out there that I really appreciate that this meeting was held in evening hours. I know I can't speak for everybody, but just having littles at home, it was just really great to be able to be a part of this, hear the discussion, and maybe it's just another thing maybe moving forward. I just appreciate having evening meetings that we could tune into. So thank you so much.
Thanks, Jen. And thank you, everybody, for attending. And we will get this posted to the website and hopefully get some FAQs out to interested parties as soon as they're available.
Can we get the website address again, please? I'm sorry, I don't know what that website address is, where it's going to be.
It's www.oregon.gov/PH/HLO. And if you scroll about halfway down in the middle of the page, you'll see Board of Sign Language Interpreters. And you click on that.
The last three were HLO?
Yeah. Mark? Yes. Okay, thanks everybody. Have a good night.
Thank you.
Thank you.